My question would be, do you have any examples that you could share, of this initiative being rolled out and what benefits people have encountered from it?
The original endeavor that I led years ago, right around 2021 is when we got it started. And we did a large analysis on the impact that this had on patients. And when we were looking at what to measure, we measured patient volumes, how many people were affected. And it was one of those things that right at the end, one of the trainees kind of thought we should measure their hospitalizations and ER visits because that's going to be impacted. Because we parked care out in these rural communities, we studied the impact on the rate of those individuals going to the ER or the hospital. And I distinctly recall the day we had our first meeting on the data analysis, and we all kind of teared up because we knew we were going to have an impact. We didn't know it would be this big. So I'm specifically talking about Crohn's disease and ulcerative colitis patients. That's where we were spearheaded the endeavors, where the volumes were the highest. And we wanted to study right away. So we specifically looked at that. And because the endeavor was led by yours truly, that's the clinical arena we studied. And so it all made sense. Um, and it's myself and one colleague. At that point, we were just literally two of us, Crohn's and colitis specialists at this large organization. And here are the numbers, Tomas. 2,992 patients is the volume of patients that we studied on their rate of hospitalizations and ER utilization.